Welcome back to Pharmacy News, and we're delighted to have Dr. Lynsey Hayward with us, Urogynaecologist and President of International Urogynaecology Association.
Yeah.
From just over the ditch. You've made it in time. Thank you for your time, Doctor.
No problem.
Now, what do you hope pharmacists will take away from your session this afternoon?
I just want to raise the awareness of urinary incontinence in the patients that are coming through the pharmacy. You'll find that 1 in 3 of the adult women coming through will have some degree of issue with urinary incontinence, but most of them won't have mentioned it to anybody, often not even their partners.
Why is that, do you think?
There's a real social taboo. There's a matter of shame, embarrassment. There's also a normalization that people think, well, I've had children, I can expect a bit of a leak, you know, well, we're all in the same boat and I'll just get on with it. And mothers, you know, they always come last. So
is that one of the major causes of incontinence?
Childbirth is the most common cause. There are other causes such as obesity, people with asthma, chronic cough, that sort of thing that can also trigger it. Some people have a genetic disposition to it.
What are the mental health aspects associated with incontinence?
If it's very mild, probably not too bad, but once you get into the point where you're wearing a pad every day, you're always worried, can anyone see it? Can they smell me? I can't really go to the gym. What if they see under my lycra? For people with overactive bladder and urge incontinence, which is a sudden desire to go to the toilet, and often they can't control it and then you just leak, that's probably the worst. If you're going to sneeze, you anticipate, and maybe you see people crossing their legs or they make a joke of it. With urge incontinence, you could be in the middle of the supermarket and something, oh my goodness, I've got to go, and then leak. And if that happens to you once, the sort of fear of it happening again is enormous. So people begin to make their lives smaller. They won't travel far. They want to know where the toilets are. There's even an app that the Continence Foundation put out that identifies the toilets all over Australia.
Really?
Yeah. So people plan their lives around the bathroom.
Of course, my goodness. So what's the treatment? What can pharmacists do if a patient presents with incontinence?
I think if you had some sort of awareness or some profiling about it, there is a World Continence Week, which is the last week of June each year. Maybe use that as a time to advertise, you know, there are treatments available, for example, for people with stress incontinence, which is the leakage during exercise and coughing. The primary treatment is physiotherapy, and often people try that, or they say, I've done my pelvic floor exercises, but then they don't know that there's another step, and that would be going to your family doctor and getting referred, and we can do a surgical treatment. It takes 12 minutes to fix a leak.
Really? Is that right? So there's plenty of treatment options.
Plenty of treatment, and there's also pharmacotherapy available to help women as well, and behavioural therapy for women with urgency, so retraining their bladders. So sometimes women will put a key in the front door and it triggers them, just like if you smell nice food, it makes your mouth salivate.
Yes.
There are lots of triggers, like hearing the shower running. You can get trained out of those to a degree, and if that doesn't work, then you can have medications and sometimes even things like Botox into the bladder to keep it relaxed.
My goodness, so plenty of options, and there should be no taboo.
No taboo at all, no taboo.
Doctor, thank you so much for your time.
Problem.
Enjoy APP 2016 and Australia, and we'll see you back here next year.
No problem.
We'll be back with more pharmacy news shortly.